Ladies and gentlemen, we are back for yet another episode here of Knight Brothers Commentary. Matt and I getting together. Our last episode featured a local educator. We were talking about autism, and we're going to shift topics here tonight, as we always do. And tonight we're going to be talking about Medicare-For-All. And really what got this started for us, Matt, was Matt found an article that was done by the Mercatus Center at George Mason University. The title of the publication is The Costs of a National Single-Payer Healthcare System. And they're kind of, what would you say, Matt? Kind of like a think tank almost?
Yeah, they are a libertarian think tank.
A libertarian think tank. Okay, so that's sort of the biases, if you will, of of who put this together. But what I'm going to do here for us, just to kind of set the stage, is I'm going to read the abstract from this publication and then turn it over to Matt, and we're going to kind of dive in on some things that we found unique and interesting about the report. So the abstract reads as follows: the leading current bill to establish single-payer health insurance, aka the Medicare-For-All Act, would, under conservative estimates, increase the federal budget commitments by approximately $32.6 trillion during its first 10 years of full implementation. This projected increase in federal health care commitments would equal approximately 10.7% of GDP in 2022, rising to nearly 12.7% of GDP in 2031, and further thereafter. Doubling all current projected federal individual and corporate income tax collections would be insufficient to finance the added federal costs of the plan. It is likely that the actual costs of Medicare for All would be substantially greater than these estimates, which assume significant administrative and drug cost savings under the plan, and also assume that healthcare providers operating under Medicare for All will be reimbursed at rates more than 40% lower than those currently paid by private health insurance. So that is the abstract, and that sort of sets the stage. There's some things that we'll pull out of that, as well as other items that we're going to pull out of the report itself. But with that summary, Matt, I'm going to let you dive in and kind of start sharing your thoughts.
Okay, so for me, when it comes to single-payer healthcare, I just do not think that it will work on such a large scale. I really don't. To be fair, this article came out in 2018, so it is a little dated, to be honest. But for me, when it comes to the Medicare for All, I was looking at one of the tables that they had, and the financial effects is basically really bad. Because for 2022, when they said this was going to be enacted,
the projected
the projected start date for the program, that was like $3.8 trillion. But by the time 2031 comes around, it practically doubles to $6.4 trillion.
Correct.
To me, that is just insanely high.
It is insanely high, and it's something that, here's the challenge, Matt. I'm not sitting here saying that we don't have challenges with the current system and that we shouldn't try to provide care to those who need it, right? I think generally, most of America can probably get behind that yes, there are flaws in the current system, and yes, we need to try and offer health care to more people that desperately need it, right? I mean, do you think that's fair?
Yeah, that's totally fair.
And I just, for me, I think it becomes more about, I don't care if it's Trump or Bernie or insert name. I don't care who it is. I think it's more about talking about what's realistic to achieve those two things without going so far beyond what is in the realm of possibility. 6 point whatever trillion is not realistic unless we are going to redefine what it means to be an American citizen today. I mean, this redefines us in, I believe, a very negative way, because it is handing over. There's a whole litany of issues by handing over, programs to the government that we can talk about here in a little bit, and I'll get into. But it just does not make sense from a dollars and cents standpoint. So spending time on it, to me, is counterproductive.
I mean, that's a fair point. And one thing I really wanted to bring up was the fact that when you look at the countries that actually implement single-payer healthcare, Look at the size of their populations. They are not that big. I mean, the Scandinavian countries, I mean, Sweden is like 10 million from what I know. I think Norway's a little bit less than that. Canada has like 36 million people now. So, and Great Britain, they have about 70 million, if my math is right. But think about that. We are a country of 300 million people, more than 300 million people. How can you provide quality health care to so many people? I mean, to me.
Well, and that's where I go back to, I have a couple of notes here from the article, Matt, and here's one, that I read in the abstract, but I'm going to read it again. Doubling all federal, individual, and corporate income taxes going forward would be insufficient to fully finance the plan, even under the assumption that provider payment rates are reduced by over 40% for treatment of patients now covered by private insurance. So not only are you reducing, almost cutting in half, right, what you're saying the cost is going to be, but even if you were to do that and be successful in that and double the federal tax revenue, it's not sufficient to make this plan a reality. So I don't even know why we're having a conversation. I don't know how it's gotten so far down this road. And I understand, Bernie and the grassroots. And listen, I understand why people are gravitating to his message. Listen, doesn't it sound great, Matt? You can just get health care for free. There's a lot of allure there to somebody who maybe feels like they don't fit in society today. Or they don't have a place, right? Or they're struggling for whatever reason. But again, I don't think it does that person any service to sell them on a lie. Do you understand what I'm saying?
To a certain extent, yeah. But here's the thing, though. I feel like certain states could do their own version of Medicare-For-All. I mean, for example, in Wyoming, Wyoming is basically a population that has, just slightly over 500,000 people. I think it's like almost 600,000.
Yeah.
So you could do single-payer healthcare in smaller states.
Right.
But doing it on a much larger scale, I just don't think it could work.
And Matt, I again, we're in agreement on this. It just... Again, I feel like it's such a hard topic to discuss because I'm not trying to turn this into a political discussion. I'm not trying to poo-poo anybody who supports Bernie. Although, again, I think there are major flaws in the messaging that he's providing. I think you're going to be sold a bill of goods that will never be fulfilled, so to speak, if you choose to go that direction. But that's your choice, and you have the freedom to do that, and I support that 110% because that's what this country's all about, right? My thing is just, I'm trying to, I'm just trying to figure out for somebody who is a proponent of this plan, where they see the rubber meeting the road. Because what I don't want to have happen is, let's say we are living in a Bernie administration. These things are, the numbers speak for themselves. It's never it can't happen without a total, America would be totally different. Our tax rates would go through the roof. Here's what happens. And this is, again, I'm not an economist. You know what I do for a living. I'm a salesperson, but it does come down to basic economics of supply, demand, competition, and what that drives. And really what I see is if you take this and there's, I want to try and find this line, in the article. So here we go. And this is kind of where I want to take the conversation. So, This is a quote from the publication that Matt's bringing forward here. It says, perhaps some facilities and physicians would be able to generate heretofore unachieved cost savings that would enable their continued functioning without significant disruptions. So they're saying maybe they could achieve it. However, at least some of these facilities and physicians would undoubtedly not be able to reduce their costs, thereby reducing the supply of healthcare services at the time Medicare-For-All sharply increases the healthcare demand, right? So because we're asking them to basically operate, the study assumes 40%. That's what's written into the plan. Operate at 40% less revenue generation, right?
Yeah.
At the exact same time that now you're saying anybody in the country can go access healthcare. So not only are you bringing in way less revenue per person, you're also asking them to take on, I think there's something like 180 million insured today. So you're not quite doubling your clientele, so to speak, but almost doubling the number of patients that you would be taking on. So it is impossible, and I'm going back to the article, it is impossible to say precisely how much the confluence of these factors would reduce individuals' timely access to healthcare services, but some such access problems almost certainly would arise.
Oh, right? Absolutely. There's no question about it.
So although you may have coverage, the access would be challenging. And then again, so I'm going to read.
Yeah, and that was kind of the point I was trying to make with regards to our population versus the other countries that actually have this system.
Yeah.
Because with a population like Canada's 36 million, I mean, Is it going to struggle a little bit? Sure. But it still works because...
Right.
Because, I mean, you're not servicing that many people. It's like... Because, I mean, in our current system, we have 180 million insured. That's like maybe less than a quarter.
It's like a fifth.
It's like a fifth.
Maybe a little more. But my point being, here's the... And again, my whole thing is we are trying to say that this is something that can be rolled out and everybody's going to get healthcare as a human right? Well, and all these other countries that you're mentioning, Canada, Scandinavian countries, Great Britain, whatever. And that's what Bernie, look at every other, country in the world that has this, blah, blah, blah. That's great. But here's the reality. America is by far and away the most innovative and competitive medical environment in the world. Okay? All of the major medical breakthroughs are happening in this country due to competition, because competition drives and forces innovation amongst those who are competing. Right? So if you take away the incentive to compete, you take away the incentive to innovate. And that's where I just think handing this over to a government entity completely destroys all the things that make, and I promise I'm not trying to make this a pun, that make America great, is the fact that the competition drives us forward. I mean, if you think about all the technological advancements that have happened in our country in the last 20 years, that's because innovation is put at a premium among corporations. And I very much get the argument about corporate billionaires and greed and this, that, and the other. And I'm not a proponent of any of that, but let's call it what it is. We're talking about basically 600 billionaires in the world. Okay. So you're going to ask 600 people to now foot a huge amount of the bill here for everybody to get this private insurance that most undoubtedly is going to create a complete void of innovation and perpetuation of medical technology. Does that make sense, Matt? I mean, do you agree with that assessment?
To be fair, I mean, I do think there's some truth behind it. Because at the end of the day, I mean, when there's no competition, there's no innovation, but also there's no innovation when there's no efficiency. And I think that's going to be the problem with Medicare-For-All, especially if we try to adopt it on a national scale, because everything's just going to bog down. There's no time for innovation. There's no time you're just solely focused on the patient. There's no really room to grow.
Right.
But here's the thing, though. When it comes to... I'm not necessarily opposed to single-payer health care, like I said before, for states with smaller populations, because it could work. It really could. But when it comes to having a national plan, I think what we need to do is treat health insurance like car insurance. I think what we need to do is require everybody to have some form of health insurance, whether it's provided by the government or a private entity like Anthem or something.
Yeah.
I'm trying to think about the best way to put this. I also think we should try to open the markets as well. I think we should try to have more drugs come in from other countries, just like just like any other product, really, at least when it comes to not violating all the copyrights and patents. So if we could try to start importing more and more, that will hopefully lower the price down for a whole bunch of prescription drugs that people may need to rely on every single day.
Yeah.
So for me, when everybody is required to have insurance, that hopefully lowers the price down for insurance.
Right.
Because everybody's got to have it. And when you have a much larger supply coming into the country, that also lowers the price. Yeah. So hopefully that will at least make healthcare a little bit more affordable for the average American like you and me.
Right. And, again, it's hard because I've never been, and again, this is a conversation about transparency. I've never been without health insurance, right? I was on our parents, and then I had a job, and, I just opted into my corporate plan. And so I don't know what it's like to be uninsured and incur significant medical, debt, right? Have something come up where I have to be covered. And I do think that we have to be, there has to be a voice for those people, right? And
absolutely.
And I'm not saying that I'm that voice, but I'm also not so self-absorbed to realize that exists. And there are people that for whatever reason, don't have those means. And as a society, we have to be willing to step in and help. Right.
Yeah.
And I think
that's where I kind of have to agree with Bernie Sanders. It's like, we should be doing more to improve the social safety net that we have. To me, there's no question that we could be doing more and we should be doing more. But I just don't think that single payer healthcare is the right way forward.
And I think we're in agreement there. And so I think that's the right way to look at this, is that we should be doing more. We could be doing more. So I guess, and you've already outlined a couple of options about what that could look like. I do also think, we have to have a real conversation around, those who are uninsured, because there's got to be some level, and again, I've never been in that situation, so I don't know the circumstances, but there has to be some level of individual responsibility or accountability, right?
Yeah.
The reality is, if you are working to obtain a job in a variety of fields, and Matt, you can speak to this because you've been working contract positions that don't provide health care, right? So you've been in that very position. I have not. But I guess my point is, if as a society we are, as we said, should be doing more, could be doing more, if we're going to take those steps, I think it has to be a two-way street, in that you can't just scream, I'm uninsured, I'm uninsured, I have kids and I need insurance for myself and my kids. Well, society didn't make you have the child, right? That's an individual decision in 99.9% of cases, right? Outside some sort of criminal activity going on. You chose to have a child. Nobody made you do that.
Or if, like let's say the birth control doesn't work or the condom breaks or something.
Well, and I'm not trying to go down this road of this but even still, Matt, there is a very sure-proof way to not have children, and that is a decision that you can make. Fair?
I suppose that's one way of looking at it.
Well, it's just the truth. If you choose to abstain from that activity, you will not have a child.
Unless you get raped.
And I already said, excluding a criminal circumstance. I know you want to speak very specific. You're very black and white. But my point being, there has to be some level of responsibility and accountability put on the individual. They have to, just because you made bad decisions in your life doesn't mean that all of a sudden, you're just going to get bailed out. Now, and I'm not saying having a kid's a bad decision, but I'm saying if you chose to do that and weren't in a position to take care of that child, society can step in if you're willing to show an intent to pick yourself up. But you know what I'm saying? Pick yourself up on your own.
Or at least try.
That's what I mean. Yeah, putting some effort forward. Are you out trying to work? Can you hold a job even if it doesn't provide benefits? Are you trying to work up and educate yourself, whether it's self-education or, listen, you can go on YouTube for free and learn just about anything. I mean, literally, like think about how many how-tos you can. Hell, the way that I manage a lot of my life is based on things that I have self-taught through acquisition on the internet. I mean, we literally can type something into our phones and have that information in 0.2 seconds or less. on any topic anywhere in the world. It's unbelievable, the access to information. There is more opportunity now for an individual to self-sustain or create the life that they want if they're willing to work towards it. I mean, don't you think that's a fair statement?
I do think that's a fair statement.
And I get it that there's always going to be obstacles, and that is where society has to have a collective voice to say, we need to help these people out. But I just think it's got to be a two-way street. And that's where I think you see the major, and again, we talk about politics, so I'm going to bring this into the fold. I think that's where you see the major rub with a lot of people is that, set aside the fact that the financials don't add up for Bernie, right? This Medicare-For-All financially doesn't make sense, not realistic. And in all actuality, I never want to say the word never, but this is likely never going to happen. It's just not feasible. I should never say never, but it's very unlikely that even if Bernie gets elected, we see anything remotely close to this full implementation, right?
Yeah.
Unlikely. But the rub is that you have a lot of people out here supporting this, and the conservative stance has a really hard time seeing those people as anything but looking for a handout, right? Oh, you want free, healthcare. Oh, you want free housing. Oh, you want welfare. Oh, you want student loan debt forgiveness. All of these things, the Green New Deal, whatever. We're going to, shut down every industry in America to save the world based on what I would call, insufficient information. I just think that we have to be willing to talk about that middle ground where somebody who is conservative can think that, but there has to be a large, I guess where I'm going is there has to be a large faction of people supporting Medicare for All that meet the description of fell on hard times. They're really trying to get their life in order, and having their health insurance taken care of would be a huge burden lifted off their back, right?
Yeah.
And they're doing all the right things. And I think that's the system that we need to be talking about is how do we help those people? You know what I mean? Do you agree with that?
Yeah.
That to me, that's where this has to go. And I don't know. I just be curious. I'm just curious how this all unfolds. I don't know. And again, I always take us off the topic of the notes here. I don't know what else you have on there, Matt, from the article itself. It's just a really challenging discussion because we're talking about so many people. Everybody has a unique circumstance. You don't want to be so obtuse that you aren't open to understanding how other people live and the challenges they're in. But I also think for Bernie to try and sell them on something that he has to know, he cannot be that ignorant to believe that this financially is going to come together without absolutely destroying our economy. I just don't know how he can look at it and see it any other way. Am I crazy?
Yeah, so basically, it will basically just be like the stock market just completely collapsing back in the 20s and starting the Great Depression. But
well, it's going to be interesting to see how this whole thing shakes out, again. And I just think that we always have to be open. And we say this on the podcast every time. If you have thoughts, if you have ideas that, Matt and I have kind of talked about trying to find some middle ground here to help maybe those that are disenfranchised, but that are working to try and, they're just working to better improve their situation. And that's what I think we're all trying to do. I mean, and it looks different for everybody, but we have to be willing to talk about solutions that are realistic and can help those people now, because that's the challenge is what, we're talking about all these programs. It's always like a carrot on a string, right? When these politicians talk about programs, what can we do now? You know what I mean? I guess that's where I always struggle is, I don't know. This just seems so far-fetched to me that I hate how much it even gets covered because it's just not realistic. And that's frustrating.
Yeah.
I don't know, Matt. What else? Any other thoughts?
Yeah, I think we're good.
Okay. Well,
we'll put the notes on the website so that way, and we'll give you a link in the description below so that way if you want to check the notes, you can.
Yeah, and I will just chime in. This was I think this was one of our more challenging podcasts together, Matt. It's just a hard topic to try and wrap your arms around.
I suppose that's fair.
But anyways, if you have thoughts, let us know. We're certainly open to hearing feedback, and we'll see how this all shakes out.
All right. See you guys.